The world around us is changing, and the needs of the people in the Western Pacific region are changing too. We are facing new health challenges, but there are also incredible opportunities to create change. The World Health Organization in the Western Pacific has a vision to become the safest, healthiest region in the world. We are working to address the 4 greatest health challenges facing our region today. Health security affects us all. If one country is vulnerable, every country is at risk. We need to work on preparing for pandemics, preparing for and mitigating natural disasters, and fighting antimicrobial resistance. Non-communicable diseases, like heart disease, stroke, diabetes and cancer, are responsible for 4 out of 5 premature deaths in our region. And as people are living longer, these conditions are becoming more common. We need to build on our successes in prevention, such as tobacco control, while also building health systems that can care for people throughout their lives, rather than focusing on treating a single disease. Climate change presents a major threat to the health of our region. Heat stress, malnutrition due to food insecurity, displacement from rising sea levels and more extreme weather are just some of the risks that the changing climate pose to health. At the same time, environmental issues like air pollution must be addressed. Over recent decades, we have seen huge gains in some areas. Together, we've dramatically reduced deaths from infectious diseases like tuberculosis. Malaria rates have lowered significantly, and the number of children dying before their 5th birthday fell more than 60% over the last decade. But these struggles are not over, and progress has not been evenly spread throughout the region. We need renewed efforts in the fight against infectious diseases and to keep improving the lives of children and mothers. In this changing world, we need to be smart about the way we work. WHO in the Western Pacific is working to support and collaborate with member states in 7 key ways. We need innovative solutions, from big data and artificial intelligence to smarter low-tech solutions. We are supporting member states to identify, test and adapt innovations in health and develop platforms for connecting and learning from each other. Backcasting means developing a long-term vision of where we want to be in the future, then working backwards to identify the actions we need to take today to get there. It's about better long-term planning, with clear goals to guide the way. Every action we take should contribute towards the bigger picture. With universal health coverage as the foundation, we will work with member states to take a system-based approach to health. In many countries, health services are fragmented. To make sure everyone receives the care they need, where they need it, we need stronger systems. Our region is incredibly diverse. Actions to meet today's health challenges must recognize the richness and variety of places and people who live here. We need solutions built from the grounds up. This means supporting innovative solutions that draw on local resources and ingenuity. Whether from communities, faith groups, schools, or cities, there are countless places from which local solutions can come, hence the plural grounds up. Many of today's biggest health threats come from outside the health sector. Climate change, antimicrobial resistance, and risk factors that drive NCDs are examples. We are improving the way we engage with other areas. Part of this involves gathering and sharing evidence on the value of good health decisions to other sectors. Our decisions today and in the future must be based on evidence. We are strengthening how the impact of work to improve health is measured. With this powerful information, countries will be better able to use data to improve policies and systems, and ultimately people's health outcomes. Social media, the 24-hour news cycle, and rapid developments in communications technology mean that people are bombarded with information all day, every day. In this context, communication as a tool for improving health is more important than ever. WHO, member state health agencies and partners must be clear, trusted voices for health. Using these approaches and areas of focus, WHO, together with member states and partners, is ready to address the health challenges of today and tomorrow, to make the Western Pacific the safest, healthiest region in the world.